Americans will want to get screened for colon cancer at an earlier age. The U.S. Preventative Services Task Force recently lowered its recommended screening age from 50 to 45. Now, colon cancer is the third most common cancer in the United States, and here in Colorado, there are an estimated 2,100 new cases each year. So here now is Dr. Chris Liu. He's the Associate Director of Clinical Research at the CU Cancer Center. And Dr. Liu, we're thankful to have you here. I'm curious, why this change?
Absolutely, and thank you for having me. As you stated, colorectal cancer is the third most common cancer worldwide, and this year there will be 1.8 million new colorectal cancer diagnoses worldwide, and within the United States there'll be 150,000 new cases diagnosed just this year. When you look at the average age of diagnosis in the United States, it's around 68 years of age. But while colorectal cancer has been decreasing in the older population, and this is just due to better screening, prevention, and colonoscopies, we know that in the younger population, where we don't typically screen people or get colonoscopies, the number of cases actually rising, and it's been rising for decades. In fact, the incidence of early age onset colorectal cancer is expected to increase by 140% by 2030.
Wow.
So by lowering the age of screening to 45, this is in response to this concerning trend. And we're seeing this rise not only in the United States, but actually the entire world as well.
Well, as you might imagine and can probably understand, a lot of people do dread colonoscopies. So what would you say to someone to convince them to make sure they get screened? This is really important.
Absolutely. You know, I always say as a doctor, getting colonoscopies for my patients is really easy because I just click a button, but it is. There's a lot that goes into getting a colonoscopy. But the most important thing to remember here is that colorectal cancer is a largely preventable cancer. We know that colorectal cancers develop from polyps that form in the colon and the rectum. And when they're left untreated, these polyps have the potential to become cancers. And just by taking the time to get screening and to get a colonoscopy, you can remove these polyps and prevent a cancer that would develop later in the future. Or if you already have a diagnosis of cancer, you are much more likely to find it at an earlier stage where it can be surgically removed before it grows, spreads, or gets out of control, where the cure rates are much, much lower.
Well, you hinted this, Dr. Liu. You say prevention, of course, is key to so many cancers. So besides getting screened, what are some of the symptoms of colon cancer that people should maybe know about and could potentially look out for?
Yeah, so like many cancers, the signs and symptoms of colorectal cancer can really oftentimes be vague, and they can be common symptoms that people experience just in general. So things that you should look out for are a persistent change in your bowel habits. This can be like diarrhea or constipation. Any rectal bleeding or finding blood in the stool should be of concern, any persistent abdominal pain. And of course, if you have any unexplained fatigue or weight loss, these are all things and all symptoms that that don't necessarily mean that you have cancer. More often than not, you won't have cancer, but we want everybody to discuss these symptoms with their primary care provider.
Sure.
Because as long as everybody understands that you are never too young to have colorectal cancer, it will always be in the back of everybody's minds, and therefore it will be harder to miss and ignore.
Right. Well, all the more reason why it's important to check in with your physician and see your doctors regularly. But we know, doctor, with the pandemic, a lot of people haven't been going to see their PCP like they should. So if someone has gotten behind on their health, what is the first thing that you recommend they do?
Absolutely. You know, the COVID-19 pandemic led to a lot of stopping of general care. In fact, a lot of hospitals just stopped doing screening colonoscopies altogether because of the rates of admission that we are seeing with patients having COVID-19. Now is the time to kind of get back on the horse. Now's the time to kind of focus on your health, to make sure that you're meeting with your primary care physician, and to make sure that your screening is up to date. And it's never too late, right? So just because you're a little bit behind doesn't mean that you can't get right back into it and get that screening done now, because again, the hospitals are open, these screening tests are being performed, and the best time, of course, is always now.
Absolutely, and we know hospitals are certainly a safe place to be. We've all been through a lot, and health needs to be a priority. So thank you so much, Dr. Liu, for your time and for your insight. We appreciate it greatly. And for more information on the new colon cancer screening guidelines, as well as the CU Cancer Center, just head to cbsdenver.com.